Hi, everybody. So exciting to be at the SMSNA. So for those who I don't know, I'm a board-certified urologist, but I actually became board-certified also in lifestyle medicine in December. So excited to share with you more about why I think lifestyle medicine is especially important for sexual medicine, perhaps most of all for all of the fields in urology. And so really, lifestyle medicine as a specialty is focused around 6 pillars, which are whole food, plant-predominant nutrition, physical activity, restorative sleep, avoidance of toxic substances, social connection and positive psychology, and stress management. This is really a whirlwind. Luckily, I don't have to spend much time on this since we just heard Dr. Miner give an excellent summary of how, sexual dysfunction can really be an early warning sign for underlying cardiovascular disease. And thus, already the guidelines on erectile dysfunction, for example, discuss the importance of lifestyle modifications such as changes in diet and physical activity. So this is a nice summary slide of what I'm about to tell you, but basically why the lifestyle medicine pillars are so important for sexual function is that meat, contrary to popular myth, is actually associated with sexual dysfunction, whereas plant-based food is associated with a lower risk. Additionally, physical activity is associated with improvements in sexual health. We already heard a little bit about sleep apnea earlier, but this, of course, is associated with sexual dysfunction. Smoking, also associated with sexual dysfunction in both females and males. Obviously, problems with a relationship and these types of issues with couples can contribute to sexual dysfunction. And stress, of course, plays a role in sexual dysfunction as well. So there isn't a single pillar in lifestyle medicine that does not apply to the field of sexual medicine. So let's start out here then with nutrition and why plant-based eating is so important. And this is because the standard American diet, if you look at the acronym, that it is SAD, because it is really sad what it does to the body. Yuck. So what we really recommend is whole food, plant-predominant nutrition. And this doesn't mean whole foods like the grocery store whole foods. This means whole, minimally processed foods. So the emphasis here is on unprocessed plant-based foods, so minimizing animal-based foods and minimizing processed foods. So the staples really are legumes, fruits, vegetables, and whole grains. And just so you know, this is the position statement from the Academy of Nutrition and Dietetics, because people say, are like vegan or vegetarian diets something that is recommended for people at different stages of life, maybe pregnant patients, lactation, older adults, and yes, it is actually identified as something that is nutritionally adequate and offers health benefits at all life stages. And specifically here, since we're here to talk about sexual health, there's now a growing number of studies showing that people who consume more plant-based and less animal-based food have a lower risk of erectile dysfunction and better scores for erectile function among those already diagnosed with ED. And so these are just a few of a growing number of studies on this topic. Now, interestingly, this is something we published this past year, even in the prostate cancer population, which is what I mostly work with. This is a very tough population because with surgery and radiation for prostate cancer, you have these added insults to sexual health. So we didn't think that necessarily you would see any difference with nutrition in this kind of population, but indeed, the people who ate the most plant-based and least animal-based food after surgery and radiation for prostate cancer had up to 11% better scores for sexual function, not to mention less urinary symptoms and less hormonal symptoms like low energy and depression. So this was surprising and exciting. And there's a number of ways that eating more plant-based foods can really support sexual function. Most of people who follow these diets lose weight, cholesterol goes down, so you're having, less atherosclerosis, better blood flow, antioxidant properties, etc. So lots of great resources out there. So for anyone who wants to, speak more about this to patients, some documentaries. Game Changers actually has a segment in it specifically about the sexual impact of plant-based diets. There's some jumpstart programs that are all virtual to help patients get off the ground. So I often send my patients to these to help out. Purple Carrot is a meal service that Scott Egner actually got me started on, another urologist, a few years ago, and a whole bunch of us prostate people actually use this meal service ourselves, but very helpful to learn about, plant-based cooking and how it can be very delicious. And then Happy Cow is a website and app that you can find plant-based food anywhere in the world. It geolocates where you are. So this really is something that is feasible even for busy people who travel. Now moving on to sleep health. So obviously it's no surprise to those of you in the audience as specialists in sexual medicine that many studies now have shown these strong links between sleep apnea and erectile dysfunction. And for example, in this systematic review, the odds ratio was 0.45, like a dramatically lower risk of sleep apnea in people who did not have erectile dysfunction. Lots of possible mechanisms here: cavernosal hypoxia, reduced nocturnal erections. So this is something that we really need to be screening for. And probably many of you in the audience are already using the Stop Bang screener in clinic for your patients. If you aren't, then you should start. And most of our patients are starting out with at least 2 of these right off the bat, at least in my practice with mainly prostate patients. They're already mostly males over 50, and many of them also meet the BMI criteria or the blood pressure criteria, so it doesn't take a lot to go up on the points here. So I would say on a given clinic day, I'm probably actually referring at least 3 people for sleep studies. Physical activity, of course, lots of studies showing physical activity, for example, associated with sexual quality of life in women. This is a very nice meta-analysis looking at aerobic physical activity associated with this significant improvements in erectile function. So the authors recommending this is a great low-risk, non-pharmacologic therapy for patients with erection problems. So again, if you don't know this already, I think this is something that all physicians should be aware of. What are the physical activity guidelines? And this doesn't change with age. This is for all Americans. We should be recommending 150 minutes a week of moderate intensity aerobic activity, or 75 minutes of vigorous intensity physical activity, as well as 2 days a week of muscle strengthening. Avoidance of toxic substances. So your penis definitely thinks that you should stop smoking. Love this ad from the NHS. But the reason for it is smoking is associated with sexual dysfunction. Lots of, systematic reviews and meta-analyses showing the links between smoking with female sexual dysfunction and with erectile dysfunction, and how cessation of smoking has a beneficial impact. Also, infertility. So a surprising number of reproductive age males smoke cigarettes, and this can have impacts on semen parameters. It's associated with female infertility. So, we really need a call to action. This is a nice, paper that's just highlighting how urologists really are not discussing smoking cessation enough, even with patients with something like bladder cancer, which we know smoking is literally the main cause. But in this case, as sexual medicine specialists, this is a very powerful motivator, sexual dysfunction. So really, we need a call to action for urologists to pay attention to this and provide referrals for our patients to help them quit. And then finally, very hard to summarize an entire field of lifestyle medicine in a 10-minute talk. So this is a bit whirlwind, but I threw together the last 2 pillars of stress management, positive psychology, and social connection. And, of course, the quality of the relationship and other factors going on with mental health, such as depression, anxiety, are associated with sexual dysfunction. But also antidepressants are associated with sexual dysfunction. So we really need to make sure that we're offering our patients referrals for psychosocial support. So just as with the other pillars, our community around us can really help with these things. At a bare minimum, we should be telling patients about the free quit line. If you're based in the US, it's 1-800-QUIT-NOW. Others have different ones in different countries. And then other options for social support, communities, finding sex therapists and sex counselors, it's all there. So in conclusion, just basic recommendations from lifestyle medicine: whole food, plant predominant diet, getting sufficient physical activity, making sure we're screening for sleep apnea, telling our patients about the links with smoking and providing referrals, and then really focusing on the importance of things like relationships, social connection, and mindfulness to help with all of these problems. So I'd like to thank you so much, and Dr. Burney, for the invitation to present here. And if anyone is interested in becoming board certified in lifestyle medicine, I'm happy to chat later about what that involves. Thanks so much.